All right, this is the close-up show for bones. Bones that be difficult to learn through just the textbook photographs because the features are smaller, the bones are smaller, we're looking at them from different kinds of angles. So a couple of notes first about some of the models we'll be using. I've got one of our plastic skull models here, and I'll show you on the inside that bone edges are shown in yellow, and that will help you when I go to some of the smaller bones to help you locate where those particular bones are in the skull. This model we call explodoskull, and it's individual bones that are mounted on a clear plastic shell. And these bones are attached to that shell with little plastic pegs. And I've learned I need to tell folks that the little plastic pegs are not parts of the bones. So let's get started. And in fact, the first bone I want to talk about is indeed this bone. This is the frontal bone. Happily, it's on the front of the skull. That would be anterior, of course. It's in this area. And there's a feature on this bone that you need to know, but if you take a look at this bone, you can't really see it. The feature is the frontal sinus. A sinus, remember, is a hollow area inside a bone. And if you look at this bone, you really don't see any holes because there aren't any holes that go all the way through, but there is a hollow area on the inside of the bone. To see that, we need to look at a slice of that bone. So here I've got a sliced skull. This happens to be a real skull. And in this area, that's where the frontal bone would be. And right here, that hole, that is the frontal sinus. Now that would be inside the bone, right in this area, but of course you can't see it on the whole bone. You need to look at a sliced bone. So that would be frontal sinus. Here I've got one of our mid-sagittal head models, and of course bones are shown on this model too, and this space right here, that is the frontal sinus. Next bone I want to look at also in the skull is the sphenoid bone. Here's the sphenoid bone. This is one of my favorite bones because I think it looks like an alien spaceship. Some people say it looks like a butterfly. If you've ever seen Buckaroo Banzai Beyond the Eighth Dimension, you'll know what I mean by it looks like an alien spaceship. This bone has a sinus also. It's in this area of the bone. And again, you can't really see from the outside of the bone that there's a hollow space in the middle. You have to look at a sliced bone, and this area right here, that's where the sphenoid bone is. This hollow space and also this tiny little hollow space right here, those together are the sphenoid sinus. Let's see, that means we can also go back to mid-sagittal head. These hollow structures right there, those are the sphenoid sinus. And remember, when we talk about, especially on exams, when we talk about features on bones, we have to name both the feature and the bone. So technically, this would be the sphenoid sinus of the sphenoid bone. But remember, if the feature name contains the bone name, we can just say the feature name. So sphenoid sinus is sufficient for that feature. The next one, however, it won't be, because here we have the sphenoid bone, and the feature I want to show you is right here. It's called sella turcica. Now, in Latin, that means Turk's saddle, meaning a guy from Turkey sitting on a horse. But don't call it Turk's saddle on the lab exam. Call it sella turcica, or actually, of course, sella turcica of the sphenoid bone. It's this area right here, and it's important because this is where the pituitary gland sits. Let's see. We're going to come back to this guy in another minute. But want to switch now to the ethmoid bone. So we're there. Here's the ethmoid bone. And right now I'm holding it in anatomic position. And there are several features on the ethmoid bone you need to know about. You'll remember when I showed you the picture on the screen of the bone that we were looking at a thin slice of it and it looked almost like honeycomb. There were lots of little spaces in it. Those spaces are sinuses, ethmoid sinuses. There we go. They're also called ethmoid air cells, and there's lots of them. But this bone, actually, you can see a couple of the sinuses from the outside. So I can just take my probe and I can stick my probe into an ethmoid sinus or ethmoid air cell. Let's see, we've got a couple of other structures we need to know. Perpendicular plate of the ethmoid bone. If you look at the ethmoid bone, there are a number of structures that kind of hang down, and one of them is pretty much going straight down. I'm holding my probe right below it right now. That's the perpendicular plate of the ethmoid bone. And that bone makes up part of your nasal septum. I want to point out that when you look at the ethmoid bone from the top, from the superior side, it has a shape a little bit like an arrowhead. And back in our skull, remember I told you that the yellow lines showed the edges of bones, and right here you've got that arrowhead-like shape. This is the ethmoid bone. So you can see a little bit of its location from the superior side, but it's also located in here, not right in the front, but a little bit deeper in the skull. And that perpendicular plate of the ethmoid bone, together with this bone, this is the vomer. These two bones together form your nasal septum. They fit together kind of like that. And when you look at the inside of the skull, when you see this nasal septum right here, the inferior part, the lower part of that nasal septum, that's vomer. And the more superior part of the nasal septum, that is the perpendicular plate of the ethmoid bone. One more structure you need to know. On the ethmoid bone, we've got boatloads coming. This little guy that's sticking straight up, it looks a little bit like a sail on a sailboat. That's called crista galli of the ethmoid bone. Crista galli means rooster's comb. And it's on the most superior part of the ethmoid bone, which means if we look in the skull and we find that little arrowhead shape for the ethmoid bone, this right here that I'm touching, that is the crista galli of the ethmoid bone. That feature is important because that's the only place in your skull that your brain is actually tied down. Your brain really floats in a bath of fluid, CSF, in your skull. The only place it's really attached is right there, crista galli of the ethmoid bone. Okay, now we're going to go to some bones with teeth. First one is this one. This is the mandible. It's your lower jaw. He's had kind of a rough life here. He lost some teeth. This U-shaped bone, all of your lower jaw is one bone, mandible. But the one I want to talk about next really is this bone here. And this is how it attaches in this form to explodoskull, but there's really 4 bones here, 2 of which we don't care about because they're not on their list. This part right here, that's a bone we're not going to learn. Well, we're going to talk about it when we get to the respiratory system, but not until then. This little bone, not on our list to know. This bone is on our list to know, but I'll come back to it. So now we have a maxillary bone or maxilla. Maxillary bone, alternate name, maxilla. It's half of our upper jaw. You can see the teeth here. And this bone in the skull, you can see, well, let's look at the skull upside down. This skull has lost a lot of teeth too, but here is a maxillary bone, and look around it all you can. You can't see any hollow spaces in it, but sure enough, there's a sinus inside the maxillary bone, a hollow area. But if you've got the bone by itself, then you can see, even from the side of the bone, there's a big hollow area. That's the maxillary sinus. Okay. Now, vocabulary word before we go on. The roof of your mouth up there, which would be here, the entire roof of your mouth is called your palate. And you can see from the model that the maxillary bones comprise part of that palate, part of the roof of your mouth. So we've got a feature on the maxillary bone right here. This is called the palatine process of the maxillary bone. Palatine, that's the adjective form of palate. Process, you remember a process is something that sticks out. So clearly that little flat part there, that's sticking out, that's the palatine process of the maxillary bone. So let's see where it is on a skull. Remember, the maxillae, the two maxillary bones are here and here. This is the roof of the mouth. And you can see from those little yellow lines here and here and here, that's the boundary of the maxillary bone. And this part of the maxillary bone, right here, that is the palatine process of the maxillary bone. So far, so good? Okay, well, I'm sorry about this, but I've got a new bone for you. This bone here is a little L-shaped bone. See a little L-shaped bone? This bone fits just posterior to the maxillary bone. Here's maxillary bone, and just like in your body, they go together with little plastic pegs. No, they don't. There's how maxillary bone fits with this other bone. This other bone, apologizing in advance, that's the palatine bone. Yes, we had a palatine process of the maxillary bone, and now we've got a palatine bone. That little L-shaped bone, there's two of them, which fits just posterior to the maxillary bone. Let's see where it is on the skull. So I'm going to turn skull upside down. So here was maxillary bone. And the L-shaped palatine bone, remember I've got skull upside down, so it's going to be an upside down L. Here is where that palatine bone would be. The other palatine bone right here, upside down, L's. And if you look really carefully, there's a little yellow line right here and right here and right there. And this is the part of the palate that is made by the palatine bones. So you'll remember, of course, we had palatine process of the maxillary bone. And here's our palatine bone, and it's got a little part that sticks out. So what would you expect it to be called? A process. But it's not, sorry, it's a plate. It's the horizontal plate of the palatine bone. Horizontal plate of the palatine bone. On the palatine bone, it's right there. On the skull, it's right here. And remember, for all these bones in the skull, on a lab test, I could ask you their location on a skull, or I could just take the bone and put it on the table and have you identify it. I could have a little sticker on this saying A, and the question might be, name this bone. in which case palatine bone would be the answer. Or I could have a little sticker, maybe B, on this area of the bone, and I could say name this feature. And remember, with feature you need to name both bones and the feature, so the answer to that would be this is the horizontal plate of the palatine bone. So how are we doing? We've got this, we've got this, we've got this, we've got this. Good. Occipital bone. Next bone. Occipital bone is at the posterior side of the skull. So if I put the top back on, it's this entire area right here. And a good bit of the inferior side of the skull. Let's see occipital bone by itself. Here's occipital bone by itself. And as I mentioned during lecture, there's this large hole right here. That is the foramen magnum. Magnum, remember, means big. Foramen, that's what we call a hole that goes all the way through a bone. So I can take my probe and I can stick it right through that giant hole, and that's foramen magnum. We can tell foramens because they go all the way through. What else do we have on the occipital bone? Occipital condyles. Occipital condyles, a little bit easier to see if we start with the skull itself. Here's our foramen magnum, and right here are the occipital condyles. Remember, a condyle is a smooth, rounded surface where bone articulations happen. So this and this, those are occipital condyles. In a minute, 2 or 3 minutes, we'll meet the bone that articulates right here. On the occipital bone by itself, again, if we look at foramen magnum, the two smooth, rounded surfaces right next to it, those are occipital condyles. Okay, time to do some more foramen. Okay, so now we're going to proceed and learn a few more foramen. As I mentioned during lecture, the real plural of foramen is foramina, but I think we can just go with foramen and pretend it means both singular and plural. Optic foramen. Well, I'll bet you can guess where those might be. So here we have eye sockets, and if you look into the eye sockets, there are quite a number of slits in there, but at the very back there is a tiny singular little hole, and that is the optic foramen, also known as the optic canal. You can use either term for it. And what goes through the optic canal, optic foramen, is the optic nerve. And I think I mentioned on a lab test, if a foramen is the structure, you're going to have to know both the name of the foramen and what goes through it. So optic foramen, what goes through it is the optic nerve. I guess I better go back and remind you what goes through the foramen magnum. That's spinal cord. Okay, so here we've got the optic foramen, and what I want you to do is look on the side without the probe and see where that hole is that I've marked with the probe on this side. And then I'm going to take another probe and I'm going to stick it through the other one. So now I've got probes going through both optic foramen, both optic foramina. And now if I show you the top of the skull, on the inside, it makes an X. And it makes an X right over a structure we learned a few minutes ago. Do you remember the structure? The sella turcica of the sphenoid bone. There's an X there. And we don't have to know it for anatomy 58, but that structure actually has a name, optic chiasma, for the Greek letter that is shaped like an X. So that's optic foramen. Oh, what bones what bone, singular, would we find the optic foramen on? Well, you remember where the sella turcica was, sella turcica of the sphenoid bone. Sure enough, those optic foramen are really located on the sphenoid bone. Okay, next one we got is jugular foramen. That's going to be where the jugular vein goes through. So I've got skull here, and let's see, what's the best way to look at it? Probably from your side, the best way is here. You remember this structure, that's the foramen magnum, that's on the occipital bone, and just anterior of that and a little bit lateral, a little bit off to the side, are two jelly bean shaped holes. Jelly bean starts with a J, so does jugular. The jugular foramen are large jelly bean shaped holes just to the side, just lateral of the foramen magnum. So again, I've got a probe in one jugular foramen. Take a look at where it's at, and then also see if you can see the jugular foramen on the other side. Let's see, it's going to be right there. On the inside of the skull, you also need to know where jugular foramen are. You find it the same way. You find the foramen magnum. You look just to the side, lateral, and a little bit forward, anterior of foramen magnum, and there is jugular foramen. Jugular foramen for the jugular vein. Now we've got a tricky one. Carotid canal, also known as the carotid foramen, that's for the carotid artery. And it is really a foramen. It is a hole that goes all the way through the skull, but it does so in an interesting way. When the carotid arteries go into the skull, they go up and then in and then up again. So there are actually a couple of little right angle turns inside the foramen. What that means is my stick, which doesn't bend, it can't really go through that hole. So here, the foramen magnum, obviously a hole that goes all the way through the bone. But if I plop my probe in the carotid canal, carotid foramen, this is where it is. Probe doesn't go in because that canal, that foramen, has a couple of right angle turns. How do we find it? Well, we find the jugular foramen. Let's turn the skull this way. So here was foramen magnum, large jelly bean shaped hole, that's jugular foramen. Just anterior of that, anterior front towards the teeth, just anterior of that is a little round hole, that's carotid canal. So again, I'm going to hold the skull so you can see the carotid canal, carotid foramen that I've marked, and you can try and find where it is on the other side. Now, I told you for the jugular foramen, I would ask you on the bottom, the inferior side of the skull, and also on the inside of the skull. Carotid canal, I'm only going to ask you from the inferior side of the skull. It is on the inside, but I'm not going to tell you where it is, and I won't ask you. We'll save that for Anatomy 1. Okay, now a couple of not foramen. They are a meatus. Meatus, that's how you pronounce it, by the way. A meatus is like a cave. It goes in and stops. And both of these are auditory or acoustic meatuses, meati, which means they are relating to hearing, in your ears. So here is the skull. On the lateral side, this right here, that is the external auditory meatus. On the inside of the skull, you can see there's a big bar of bone right here on both sides. That has a name. We don't need to know it. That's called the petrous portion of the temporal bone. But in that big bar of bone, just inside, just medial to where the external auditory meatus is, on that big bar of bone, there's a tiny little hole right there. And now my probe is in the internal auditory meatus. That's it for the skull. We're going to change out and do the vertebrae next. Okay, so we've finished with all of the skull bones and features. Now we're going to start looking at vertebrae, spinal bones, and you can see there's quite a few features right on the vertebrae themselves. They're kind of complicated little bones. So here is a vertebra. And I need to tell you, with our models of vertebrae, sometimes our vertebrae come on a string. So they're all strung together. This is how we get them, and then we might take that string of vertebrae apart. But there's a consequence to that. This part of the vertebra right here, that's called the body. And you can see on this vertebra, that body has no holes in it whatsoever. And that's the way it really is. But when we get vertebrae on a string, they have holes. So here's a vertebra, and here's the body, and check it out, it's got a hole in it. That is a bogus hole. No holes in the body of vertebrae, ever, 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 even though some of our models have bogus holes. That is the body of a vertebra. Hole is bogus. Hole, bogus. Hole in the body, bogus. Now, this hole and that hole, those are really there, but in the body of a vertebrae, no holes ever. You've been warned. Okay, so here's my vertebra. We learned about the body. On the opposite side from the body is a single part that sticks out. And we know parts that stick out are called processes. This is called the spinous process. And spinous processes, they're on the posterior, and they point down when the bone is in anatomic position. So you can see that that spinous process is pointing down. If it's pointing down, I know I've got this vertebrae in anatomic position. Here's what it would look like upside down. Do you see the difference with how that spinous process is pointing up? So just for a test, is this vertebrae right side up or upside down? Upside down. Okay. That's what it would look like right side up. How about one little more subtle is, here's body, so this is spinous process. Is this one right side up or upside down? Right side up. Here's what it would be upside down. And this right side up issue is going to be important because in a few minutes I'm going to tell you how to tell apart the three kinds of vertebrae, the cervical, thoracic, and lumbar. And to do it right, you need to be able to look at vertebrae that are right side up. And now you know that trick. Okay, so we've got the body and the spinous process. Vertebral arch, we're not learning, so that's why I've crossed it off the list. In your lab book, vertebral arch should show up as in italics, meaning, again, we don't have to learn it. Okay, so here's our body, here's our spinous process, and then we've got two structures that stick out. They stick out to the side. Those are transverse processes. So at my fingers, at my slippery fingers, transverse processes, spinous process and body. And in between them is a hole that goes all the way through. That hole is the vertebral foramen. What goes through the vertebral foramen? Well, spinal cord. Some more processes. We've got a couple of little processes here that stick up. Remember, we've got this vertebra right side up. Its spinous process is pointing down, which means these guys, they do really point up. They stick out, and it turns out those are going to form joints. Here, let me show you on our string of vertebrae. I'm just going to grab a couple of vertebrae that are next to each other. And here are the structures we're talking about right there. And they're going to articulate, they're going to form a joint with similar structures that point down. So right there we have a joint formed. When structures form a joint, remember, we call them articular. So we've got things that point up, that makes them superior. They stick out, that makes them processes, and they form a joint, that makes them articular. We have superior articular processes. That's these guys right here. There also are a couple of structures that stick down. They're right here. Same idea, they stick down, that makes them, they stick out, that makes them processes. They point down, that makes them inferior. And they're going to form a joint. They're the other half of the joints that form with the superior articular processes. These guys here, seen from the anterior side, seen from the posterior side here, those are inferior articular processes. Okay, a new vocabulary word, facet. Where's facet? There's facet. A facet is the place where bones actually articulate. They're flat, they're small, flat spots, and if you look at our superior articular process, remember, superior articular process is this entire hunk of bone that's sticking up. On that superior articular process right here, there's a little flat spot. That's where the articulation, that's where the joint actually happens. So this whole hunk of bone is a superior articular process, but just this little flat spot, that is a superior articular facet. Superior articular facet there, another superior articular facet there. The whole hunk of bone, that's a superior articular process. And on the inferior articular processes, those hunks of bone that are hanging down, there are little flat spots where the joint is actually formed. Those are inferior articular facets. Okay, so now we know all of the basic features of a vertebrae. Now we get to learn how to tell apart cervical, thoracic, and lumbar vertebrae, because you're going to have to do that on the exam. I'm going to throw a vertebra out on the table, and you'll have to tell me which group it's in. So we're going to start with cervical, and I want to, let's just review first of all. What are the structures I'm touching right now? Do you remember their names? Those were transverse processes. Do you see any holes in them? Holes in those transverse processes? I don't. How about this vertebra? Do you see the transverse processes? I'll put my fingers on them. Do you see little holes in the transverse processes? Yes, you do. If a vertebra has holes in the transverse processes, it is cervical. And you guessed it, those holes have a name. They are called transverse foramen. So I'm going to put my little stick through a hole in a transverse process. That hole is the transverse foramen. It's going to make this cervical. So let's test. Is this cervical? Are there any holes in the transverse processes? No, not cervical. How about this one? Is that one cervical? Yeah. How about that one? Yeah. How about this one? Yeah. Okay, so now you can tell apart cervical from other vertebrae, and we've learned about the transverse foramen. Now the cervical vertebrae, cervical means neck. They're in this area. Oh, by the way, do you see these little red structures right there? Those are arteries, and they are the structures that go through transverse foramen on a cervical vertebrae. These are called vertebral arteries. Now, there's a bunch of bones in the spinal cord, and they all have real names. They have their area, like cervical or thoracic or lumbar, and numbers. But the only ones you really have to know are the ones in the very top, the top two, the most superior two. Those are cervical vertebrae, and in addition to knowing their cervical, you have to know their names. Remind me again what this part of a vertebra is called. Body. And check this guy out. What does it not have? A body. You can tell that it's cervical because right now I'm holding the transverse processes, and sure enough, they've got holes, they've got transverse foramen, but no body. So this vertebra is the most superior vertebra in the spinal column. It's a cervical vertebra. It's called atlas. We call it C1 for first cervical vertebrae. You don't really have to know the C1. You do have to know atlas. And this vertebra, being the most superior in the vertebral column, this vertebra is going to articulate, form a joint with the head. In particular, do you remember what these rounded structures are right here? They were occipital condyles, and these structures right there are going to articulate with those occipital condyles, kind of like that, kind of like this. And when you nod your head yes, that's happening between the atlas and those occipital condyles. Now the next vertebra down, the second one is called axis. Yes, they both start with A, they both end in S. Sorry about that. Atlas we've learned, axis is next. And if you take a look at, let me get an axis here, here we go. Remember that this was called the body of the vertebra. Right now we're looking at the inferior side of it. The superior side has something on that body, looks just like a tooth. That is the dens of the axis. Well, guess what dens means? Yeah, tooth. And the dens is part of the axis. It's how you'll know it's an axis. Is it cervical? Sure enough, here are the transverse processes with transverse foramen. And dens fits just inferior, just below atlas. Lost my atlas. Here we go. Here's atlas. Atlas fits like that. And you can see that atlas kind of encircles the dens of the axis right here, and it can rotate. When you shake your head no, what's happening is the atlas is rotating on axis. So this action, that's between atlas and axis. Shaking your head no is here. Nodding your head yes, that's between atlas and occipital condyles. Okay, so we've learned how to recognize cervical vertebrae. How about thoracic and lumbar? How do we tell them apart? Well, for that, I want to remind you what these structures were right here. These were the superior articular processes, and the little flat spots are these superior articular facets. And if you look at this vertebra that I'm holding right now, I'm holding it to you so you are seeing the posterior side, and I'm holding it right side up. You can see the spinous process is pointing down. Take a look at where those superior articular facets are facing. They're facing you. But if I grab a different vertebra, put this one down. Now on this vertebra, I'm again holding it in anatomic position, but where are the superior articular facets? They're here and here. And notice they aren't facing you, they're really facing the middle. They're facing medial. So what happens is these guys, the ones where the superior articular facets face posterior, those are thoracic. And the ones where the superior articular facets face medial, those are lumbar. So we've got thoracic and lumbar, and that's the best way to tell. But there is another way. And that other way is in this wonderful book that I recommended you get, the Visual Analogy book. And what it says is thoracic vertebra look like giraffes, and lumbar vertebra look like moose. Okay? Now, it's slightly more accurate to not think about giraffiness or moosiness and look at where the superior articular facets are facing. But if you want to think about giraffes and moose, that's okay, as long as you remember which one is which. Now, the way I'm going to test you on the lab test is I'm going to have a bunch of vertebra in a box. This box, actually. And it's not a complete set of vertebra. But what you have to do is you're going to have to tell me how many in this box there are of cervical, thoracic, and lumbar vertebra. So what you're going to do when you get to this question is you're going to pull out a vertebra, you're going to take a look at it and go, do I hold it? Am I holding it right side up? Yes, I am. Are the superior articular facets pointing straight posterior or medial? They're medial, so this one must be lumbar. I'll put lumbar over there. This one looks thoracic. I'll put thoracic here. This one, oh, check it out. It's got transverse foramen, so it's cervical, so I'll put the cervical one there. And then I'm just going to make a bunch of piles here of vertebrae that are all the same, and by the end of that you'll be able to count up and tell me how many cervical, how many thoracic, and how many lumbar there are. So it's time for us to talk about ribs, but it occurred to me while I was setting up for ribs that we've missed a structure on vertebrae. It's this one, intervertebral foramen. Now, we talked about the vertebral foramen. Remember, on a vertebra, the big hole in the vertebra and is the vertebral foramen, and it's a hole, meaning once my probe is in there, I can't make it come out. It's a hole that goes all the way through. It's a foramen. But check out from the side. Do you see a hole, a foramen, on the side? That means a hole that once I stick my probe in, I couldn't get it out. Not here, because that's, just kind of a little archy thing. No hole on the side there. But if I put two adjacent vertebra together, now I've got a hole. And when you've got two vertebrae together, the hole that they make, when they come together, that's an intervertebral foramen. And intervertebral foramen, as usual, have a structure that comes through. It's these guys here. These are spinal nerves. Spinal nerves come through intervertebral foramen. So, trick question, how many intervertebral foramen on this one vertebra. 0. You can't have an intervertebral foramen until you got 2 vertebrae. Okay, so we've picked up what we've missed. Let's talk now about ribs. First thing we need to talk about ribs is this idea of true, false, and floating. And I'm not a real big fan of these names because, you know, all the ribs, they're really ribs, which means they should really all be true, but we're stuck with these names. So true ribs, here's a true rib. This, remember, that's the sternum. And on this model, this sort of brownish stuff, that's all cartilage. The Latin name for rib is costa. These are called costal cartilages. And when a rib connects directly through costal cartilage to the sternum, that's a true rib. Now this rib down here, this is a false rib. What makes it false is that its cartilage doesn't connect to the sternum, its cartilage connects to somebody else's cartilage. So if the cartilage from a rib goes to more cartilage, that makes that rib false. True rib, cartilage, costal cartilage goes right to the sternum. False rib, costal cartilage goes to somebody else's cartilage. And then there's these two little ribs down here, and they don't have cartilage at all. Ribs without cartilage are called floating. You don't have to know how many true ribs there are, how many false ribs there are, how many floating ribs there are. But you do have to, on a lab test, if I put a little sticker on a rib, you should be able to tell me whether it's true, false, or floating. And then we need to talk about how a rib articulates with two adjacent thoracic vertebra, because that's the deal with thoracic vertebra, is thoracic vertebra have ribs attached. And I want you to see how many thoracic vertebra each rib is touching. So I'm just going to point to a rib at random right there, and if you stick your head sort of right close, you can see that that rib, what we call the head of the rib, is actually touching two thoracic vertebra. So I've got two thoracic vertebrae here, and I've got a rib here. This is what we call the head of the rib. That's a feature, this little bump, that's the tubercle of the rib. Head of rib, tubercle rib are not features you need to know, but it's helpful if I give you those names, because when I talk about how the rib articulates with thoracic vertebrae, you're going to need to know those names. So the head of the rib here is going to touch the bodies of two different thoracic vertebrae, just like that. And the tubercle of the rib is going to touch means articulate, it's going to articulate with one of the transverse foramen. The transverse foramen on the lower, on the inferior rib. So there's the tubercle, it's going to touch right here. So that is how a rib articulates with two adjacent thoracic vertebrae. The head of the rib touches the bodies of those two vertebrae, and the tubercle of the rib touches the transverse process of the inferior, of the lower of those vertebrae. Now remember, we talked about facet. A facet is a small flat area where articulations actually happen. Where this rib touches these two thoracic vertebrae, each of the places it touches, there's a little flat spot on the vertebrae where it touches. That's called a costal facet. Let's see if we can figure out how many costal facets are on a thoracic vertebrae. Well, let's put them back together, but let's think about this lower inferior vertebra here. Here's how that rib touched. So one articular facet's going to be right here, which means there's another one over here on the other side. the transverse process of that vertebra was articulating with the tubercle of the rib, so there's another costal facet there, which means there's a costal facet on this side. So we got 1, 2, 3, 4, but we're not done. Because even if these two vertebrae are there, there's going to be another rib that is down here. So there's another costal facet on the body of the vertebra down here, and another one over here. So there's actually 1, 2, 3, 4, 5, 6 costal facets on each thoracic vertebrae. Now, our thoracic vertebrae, most of them are plastic, and they don't all show costal facets very well, but this one right here happens to be a pretty nice costal facet. And that is the close-up shot.